Diabetes mellitus. What is diabetes mellitus? Diabetes mellitus is a metabolic and non-communicable disease that correlates with the abnormalities of the pancreas function. It is caused by multiple factors such as a sedentary diet and unhealthy lifestyle. However, the person can also suffer diabetes mellitus genetically from the damage of the beta cells that disturbs the insulin production. This will cause trouble in transporting glucose, thus making the blood glucose level increases. Beta cells of the islet of Langerhans in the pancreas secreted insulin. Insulin will bind to insulin receptors embedded on the cell membrane of various tissues such as adipose tissues and muscle tissues. Activated insulin receptors causes vesicle-containing glucose transporter from inside the cells to fuse with the membrane to allow glucose enter the cells. Diabetes mellitus is divided into two types, type 1 and type 2. Who get these diseases? Kids are usually affected by diabetes mellitus type 1 due to inability to produce insulin to convert glucose into glycogen. Elderly mainly suffers from diabetes mellitus type 2 due to high fasting glucose level, thus the pancreas unable to secrete insulin anymore. Facts on diabetes in Malaysia. Diabetes trend in Malaysia. Distribution of patients by age. How do they get this disease? Unhealthy lifestyle, genetic inheritance, and obesity. Why we choose diabetes mellitus. Based on statistic issued by the Ministry of Health Malaysia, there is terrifying significant increment in the number of people diagnosed with diabetes every year. The main causes of this issue is well known but being ignored by the public. We want to encourage people to be active and live a healthy life, and also we want to emphasize the danger of this disease because prevention is always better than cure. Mechanism of diabetes mellitus type 1 and 2. Mechanism of diabetes mellitus type 1. Type 4 hypersensitivity is a cell-mediated immune response that will give a signal to T cell. T cell will attack beta cell in the pancreas. Genetic abnormality cause T cell to lose its self-tolerance. Self-tolerance will prevent T cell from attacking antigen in our body, that is the beta cells itself. Amount of beta cells will be decreases. This will result in less or no insulin production at all. As there is no insulin, glucose cannot enter the cells. Symptoms of diabetes mellitus type 1. Extreme hunger. As glucose can't enter the cells, cells have no source to produce energy, thus, lipolysis will occur to produce energy. Frequent urination. Glucose is osmotically active. Accumulated glucose went to the kidney followed by water. This will increases the urine volume. Other symptoms are blurred vision, fatigue, weight loss, irritability, and increased thirst. Mechanism for diabetes mellitus type 2. Body is providing the normal amount of insulin, but the cell does not move their glucose transporter to their membrane. This is because of insulin resistance that's come from the obesity, lack of exercise, and hypertension. The cells have become filled up with fat deposit. Since the tissue do not respond well to normal level of insulin, the body end up producing more insulin in order to get same effect and transport glucose of the blood vessel. This can achieved by the beta cell hyperplasia and hypertrophy beta cell in order to pump more insulin. By keeping the insulin level higher than normal, blood glucose level can be kept normal, and this called as normoglycemia. Along with the insulin, beta cell also secreted islet amyloid polypeptide. As the increasing of insulin, the islet amyloid polypeptide also increasing. This can cause islet amyloid polypeptide is build up and aggregate in the islet. As the time goes by, beta cell will exhausted and will undergo hypertrophy and hypoplasia, making the size smaller and die off. Beta cell die and the glucose level is high, that patients can develop hyperglycemia. Symptoms of diabetes mellitus type 2 is slow healing of wound, fungal infection, itching of skin and genitals, constant hunger, frequent urination, numbness of hand and feet, unexplained weight loss, and blurry vision. Treatment for diabetes mellitus type 1 and 2. Treatment for diabetes mellitus type 1. Insulin. By injection or insulin pump. People with diabetes type 1 must take insulin every day, but the doses of insulin taken are not fixed as it depends on their blood glucose level at that time. Metformin. Metformin is an oral diabetes medication. Metformin is given to patients with insulin resistance. It will help lower the blood sugar level in the body by lowering the production of glucose in the liver. Diet and exercise. It is important for patient to have a balanced diet. Balanced diet includes nutritious, low-fat, and high-fiber foods such as fruits, vegetables, and whole grain. Exercise will help control blood sugar level. About half an hour daily of exercise are enough to keep our body healthy. Treatment for diabetes mellitus type 2. Changing the lifestyle are enough to keep type 2 diabetes under control for some cases. However, some people need medication to help them to control. Example of medication is metformin. Same with diabetes mellitus type 1. Sulfonylureas help body to produce more insulin. Megalotonides helps to stimulate pancreas to release more insulin. Thiazolidinediones make body become more sensitive to insulin. Dipeptidyl peptidase 4 inhibitors helps lowering blood glucose level. Glucagon-like peptide 1 GLP-1 receptor agonists slowing the digestion process and improve blood glucose levels. Sodium glucose cotransporter 2, SGLT2 inhibitors prevent the kidneys from reabsorbing glucose into the blood. Insulin therapy. Insulin is needed only if pancreas is not making enough insulin on its own. They might need to take a long-acting injection at night or take insulin several times per day. Creative method that we choose. Why we using animation as creative method? Our target not only to educate the adult, but also the elders and kids. Animation is easy to understand by all ages, interesting to watch and will not get bored. Diabetes not only occurs in elder but to all sex and age. All of us need to aware. Reference list. Thank you. And stay safe.